Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Muscarinic receptors. Muscarinic receptors are G protein coupled receptors. We have M1 receptors which is of GQ type, and in M1 receptors CNS is the most abundant site, especially in the CNS. It is present in the cerebral cortex, hippocampus and the striatum. Then in M1 is also present in autonomic ganglia, glands and enteric nerves. M1 will increase the cognitive activity, thus helping in learning and memory. It increases the seizure activity, decreases the dopamine release and locomotion, thus increasing the autonomic ganglia and also increasing the secretions. Then M2. M2, it is GI type which is present in CNS and heart. In the heart, in the SA node, it causes spontaneous depolarization and hyperpolarization, thus resulting in decreased heart rate. In the AV node, it decreases the conduction velocity of the AV node. In the atrium, it decreases the refractory period and also decreases the contractions. In the ventricles, it slightly decreases the contractions, whereas in the smooth muscles it again increases the contractions. In the peripheral nerves, it causes neural inhibition via the autoreceptors and also heteroreceptors. It also decreases the ganglionic transmission. In the CNS, it increases the neural inhibition, it increases the tremors and hypothermia, and analgesia is seen in the CNS. Then we have M3. M3 is GQ type. It is present in CNS and the rest of the body. In the CNS, it increases the contraction, and then in the CNS, the actions are not known, but in the rest of the body, especially in the smooth muscles, it increases the contraction of the smooth muscles. Especially this contraction is predominant in bladder. In bladder, it causes contraction resulting in micturition. In bowel, it increases the contractions causing diarrhea. Then it causes contraction in the eye resulting in meiosis, contraction of the circular muscles in the eye, or sphincter pupillae, and thus causing meiosis. In the glands, because of the contraction of the muscles of the glands, it increases secretions, especially salivary gland secretions, lacrimal gland secretions, and all the glandular secretions are increased. Then M4 is a GI system which acts on central nervous system, and it is an autoreceptor or heteroreceptor, and mediated inhibition of neurotransmitter is seen. Either autoreceptor or heteroreceptor inhibition of neurotransmitter is seen, and thus it causes cataleptic activity. Whereas M5 is GQ type, which is present in the central nervous system. It is a mediator of dilator of the cerebral arteries and also arterioles. It will facilitate the dopamine release, thus it causes drug seeking behavior and reward, especially in opioids and cocaine. It causes drug seeking behavior and reward. So easy to remember, this is M5. M1, 2, 1, 3, 5 odd numbers are stimulatory, and they activate the IP3 DAG pathway, whereas M4 and M2 even numbers are inhibitory, and they will inhibit adenyl cyclase activity.
thank you and thank you for watching.